Hi, I'm Carrie. This video series offers insight into how we prepared for, handled, and supported our early teenage son's surgery and recovery from the modified Ravitch procedure. It's purely a parent perspective and not intended to be medical advice. He had the surgery to correct a combination of Pectus excavatum and Pectus carinatum. According to the Cleveland Clinic, Pectus excavatum is an abnormal inward growing breastbone or sternum that creates a noticeable and sometimes severe indentation of your chest wall that includes your ribs. Other names include sunken chest or funnel chest. Pectus carinatum is the opposite. It's a condition which your breastbone sticks out more than usual. Some people call it pigeon chest because of how it appears. Both conditions are essentially caused by a mismatched rate of growth between the cartilage and the ribs. These chest wall conditions are typically present at birth, but can sometimes not be obvious until an adolescent growth spurt. This was the case with our child. We did not notice this condition until around the age of 11 and a half. We originally began the assessment at our local medical system, which included a chest x-ray and provided an estimated Haller index score, which is the measure that is used to note the distance between the sternum and the spine. At that time, it was noted that Pectus excavatum, the sunken chest, was present, and the carinatum was not yet identified. We were told that the best approach was to wait and monitor this condition on an annual basis, and that surgery would not even be considered until he was at least 16 years old. And this approach felt somewhat incomplete at the time, but because we didn't have anything else to go on, we waited. And as I was making the next appointment the following year, we learned that the surgeon we had originally met with had left the practice, and we needed to begin the process all over again with a new doctor. That was all it took for me to use this as an opportunity to look further for someone who had more of a specialty in chest wall reconstruction. And after some research, I felt fortunate enough to find Dr. John DiFiore at the Cleveland Clinic. You see, the Cleveland Clinic is one of 5 centers of excellence in the United States for Pectus conditions. And it was clear from our first interaction with the group that our concerns were going to be addressed. And most importantly, our son was going to be heard and his concerns were going to be taken seriously. So based on this, we decided to make the effort to travel out of state to pursue this path. You see, from our initial visit in person to all the follow-up testing, which included a chest CT scan, an echocardiogram to check the heart, and a measure of lung capacity, it gave us a more true Haller index score and uncovered the combination condition of the Pectus excavatum and Pectus carinatum. This led to the recommendation for surgery. I felt that no stone was left unturned and no questions were left unanswered. There are 2 surgical procedures available for these conditions: the less invasive Nuss procedure or the modified Ravitch procedure, which our child underwent. This is also sometimes called the open procedure. Due to our son's more complex combination of the 2 conditions, he was not a candidate for the Nuss procedure or other less invasive procedures such as bracing. In the next video, you will learn the steps we took to prepare for the modified Ravitch procedure.